Obstetric ultrasound. Obstetric ultrasound uses sound waves to produce pictures of a baby within a pregnant woman, as well as the mother's uterus and ovaries. It does not use ionizing radiation, has no known harmful effects, and is the preferred method for monitoring pregnant women and their unborn babies. The procedure is a standard part of prenatal care in many countries, as it can provide a variety of information about the health of the mother, the timing and progress of the pregnancy, and the health and development of the embryo or fetus. Obstetrical ultrasound is a useful clinical test to establish the presence of a living embryo fetus, estimate the age of the pregnancy, diagnose congenital abnormalities of the fetus, evaluate the position of the fetus, evaluate the position of the placenta, determine if there are multiple pregnancies, determine the amount of amniotic fluid around the baby, check for opening or shortening of the cervix, assess fetal growth, assess fetal well-being. Performing an ultrasound at this early stage of pregnancy can more accurately confirm the timing of the pregnancy and can also assess for multiple fetuses and major congenital abnormalities at an earlier stage. Research shows that routine obstetric ultrasound before 24 weeks gestational age can significantly reduce the risk of failing to recognize multiple gestations and can improve pregnancy dating to reduce the risk of labor induction for postdates pregnancy. There is no difference, however, in perinatal death or poor outcomes for infants. You should wear a loose-fitting two-piece outfit for the examination. Only the lower abdominal area needs to be exposed during this procedure. The sonographer may elect to examine an early pregnancy by means of transvaginal ultrasound in order to see the pregnancy more closely or to assess the cervix. The sonographer will position you on the exam bed. They will apply a water-based gel to the area of the body under examination. The gel will help the transducer make secure contact with the body. It also eliminates air pockets between the transducer and the skin that can block the sound waves from passing into your body. The sonographer places the transducer on the body and moves it back and forth over the area of interest until it captures the desired images. There is usually no discomfort from pressure as they press the transducer against the area being examined. However, if the area is tender, you may feel pressure or minor pain from the transducer. Once the imaging is complete, the technologist will wipe off the clear ultrasound gel from your skin. Any portions that remain will dry quickly. The ultrasound gel does not usually stain or discolor clothing. Most ultrasound exams are painless, fast, and easily tolerated. However, at times during an obstetrical ultrasound, the sonographer may have to press more firmly to get closer to the embryo or fetus to better visualize the structures. Any discomfort is usually minimal and temporary. If the sonographer performs a Doppler ultrasound exam, you may hear pulse-like sounds that change in pitch as they monitor and measure the blood flow. With transvaginal scanning, there may be minimal discomfort as the transducer is inserted into the vagina. This ultrasound examination is usually completed within 30 minutes. When the exam is complete, the technologist may ask you to dress and wait while they review the ultrasound images. After an ultrasound exam, you should be able to resume your normal activities immediately. What are the benefits versus risks? Benefits. Most ultrasound scanning is non-invasive, no needles or injections. Occasionally, an ultrasound exam may be temporarily uncomfortable, but it should not be painful. Ultrasound is widely available, easy to use, and less expensive than most other imaging methods. Ultrasound imaging is extremely safe and does not use radiation. Ultrasound scanning gives a clear picture of soft tissues that do not show up well on X-ray images. Ultrasound is the preferred imaging modality for the diagnosis and monitoring of pregnant women and their unborn babies. Ultrasound has been used to evaluate pregnancy for nearly 4 decades, and there has been no evidence of harm to the patient, embryo or fetus. Nevertheless, ultrasound should be performed only when medically indicated. Ultrasound allows the doctor to see inside the uterus and provides much information about the pregnancy. Risks. Standard diagnostic ultrasound has no known harmful effects on humans. What are the limitations of obstetrical ultrasound imaging? Obstetric ultrasound cannot identify all fetal abnormalities. Consequently, when there are clinical or laboratory suspicions for a possible abnormality, a pregnant woman may have to undergo non-radiologic testing to determine the health of the fetus, or she may be referred by her primary care provider to a prenatal